Robin Williams once said, "No matter what people tell you, words and ideas can change the world." Hello, everyone. Welcome to Nerdy Optometrist, a podcast channel for all things eye care, and this is your host, Ukti Vora. Before we dive into this fascinating and amazing episode for today, please don't forget to follow my channel and catch all the episodes on your favorite platform. Today, I have a fellow nerd, a true innovator, and a visionary on this episode. I have been following his work, and I'm sure many of you have also seen his work if you are into any kind of eye care and technology space, because he's a celebrity himself. I'm going to quickly do a round of introduction just as a formality, but he definitely needs no introduction. It's a pleasure and honor to have Dr. Fayiz Mahgoub. He's an optometrist with a passion for technology and eye care. He's the founder of Augmented Vision Labs, a company that is utilizing cutting edge technology to end contact lens dropouts due to difficulty with lens insertion and removal. This is the most humble introduction I've ever seen, but he has done 1 million other things that we are going to listen throughout this episode. But with that, a very warm welcome to the Nerdy family.
Thank you so much, Mufti. It's great to be with you. And that was a very, very generous introduction. If you don't mind, I might record that and just play it every morning when I wake up just to get energized. But yeah, very kind of you. You didn't have to say all those things, but yeah, definitely appreciate it.
Perfect. But I'm going to make sure that we dive into everything that you've done, because your introduction that you had shared with me does not do any justice to all the amazing and inspiring things you have done for the industry. But before we dive there, let's start from the beginning. Can you tell us, how did you bump into eye care? Like, how did it all started? Was it planned or was it an accident?
For me, it was actually a total accident. My parents wanted me to be a doctor of some type, and I was trying to find a way to be a doctor and not have to work in a hospital. So that was kind of my main motivation when I was in undergrad. And I happened to be fortunate that my academic advisor was actually also the advisor for the pre-optometry club at my school. And so she was the person who actually introduced me to optometry. And at that point in time, I had actually never had an eye exam. So I'd never had a firsthand experience with an optometrist, and kind of learning about this field for the first time was something that was kind of very new. But I was fortunate to have a great support system there at Colorado State, which is where I went to undergrad. The pre-optometry club was really well put together. We had local optometrists visit and explain to us what they did. And they were very generous to invite us to come visit them in their office and shadow after that. And so I took full advantage of that. I got to see different eye care specialties and really understand the breadth and the depth of optometry as a profession. And the more I shadowed, the more I fell in love with optometry.
Absolutely. And I think once you're in eye care, or whether it's an optometry, optician, ophthalmology, anything in eye care, there's no turning back. So here you are, not just being part of the industry, but also being part of an innovator. So, was this one of your reasons why you have become an industry leader, that you were not very much interested to be in hospitals? How did your journey from being a clinician to being part of an industry in eye care begin?
That was actually also another accident. So I attribute it to an experience that I had when I was a fourth year doing my clinical rotations. And I was at a university hospitals in Cleveland at a clinic that did a lot of specialty contact lenses. That was really one of my big passions when I was a student. And I got to work with the patients while they're being fitted, as well as once they're getting their lenses dispensed to them. And one of the major issues that I noticed with patients is their inability to be able to insert their lenses and remove them. And this ended up having those patients coming back over and over. And some of the patients actually ended up discontinuing lens wear because they could just not really use their lenses on a day-to-day basis. So that experience stuck with me, and I did more research on the topic to learn, how prevalent is this really? And I found out that it wasn't just specialty lenses, but even soft lenses. There is a large number of patients. Some studies show that it's up to 20% of patients who are fit in lenses give up on their lenses because they can't insert them and remove them efficiently. And I thought that that was really a big shame, that once the clinician invests all this time and gets a great outcome for the patient, that it ends up being for nothing, just for the only fact of the patient not being able to insert and remove the lens.
So you did mention a couple of things, and I want to start the fact that you mentioned you loved specialty contact lenses. That is your area of interest. But you also saw a gap, and I think that's where the spark of being an innovator or an entrepreneur kicked in. How did you switch? Did you think of starting off with your specialty clinic and just practicing specialty contact lenses, or was it in parallel? How did you manage to combine both of your passions?
That's a great question. So that was something that I was really debating for a long time of once I graduate, do I start a clinic? Do I work as an associate and really learn about what it takes to actually work in the eye care field outside of being a student? Or do I pursue this other path of entrepreneurship? And so the decision that I ended up going with was to work as an associate while at the same time exploring opportunities outside of patient care. And, that kind of gave me the best of both worlds. I got to satisfy my curiosity of what it's like to work in a clinic setting, and then also what it entails to actually build a business outside of patient care.
And what were your key learnings from your clinical setting to help you build the product that you're now building and innovating in?
Absolutely. It really made me think of the entire eye care delivery model and not just what the optometrist does. So, as ODs, we are really driving a big impact in the exam lane. We have great clinical skills, we have abilities to allow the patients to see better, opportunities to educate the patients. But before the patient comes to us, and also after the patient leaves the exam room, there's a whole other kind of aspect of the patient journey that we sometimes don't have a lot of awareness to. And so getting to spend some time really understanding, what our patients are going through after they're done, getting their lenses fit, after they're done asking questions to their optometrist, what are their interactions with the staff, and what is their experience like once they take their treatments home and they're just kind of there on their own, utilizing the treatments that they were prescribed.
I think the reason I love this question and I wanted to hear from you is the fact sometimes we feel that we are not uh, trained enough to be an entrepreneur or an innovator because you're trained to be a clinician. But I loved how you're kind of emphasizing that your clinical skills are core in building any new things or solutions for your patients. And that's how, how you mentioned about patient journey can contribute in making sure that the product you develop is satisfying all their requirements. So I really love the fact you highlighted the points that I was looking out for.
Yeah, yeah. For me, I always saw it as the a doctor is the person who is ultimately responsible for the final outcome for the patient. So
Absolutely.
even if you're not the person interacting with them, once the staff is taking over, you are responsible for making sure that the staff is trained, that they have the resources that they need, and that they're empowered to help the patient. So, I think that that's something that uh, all of us really, take high pride in is that we are the captain of the ship.
Yeah.
And, even if it's not something that's happening in the exam lane, we're still responsible for making sure that it gets done well.
Absolutely. And not just clinical aspect of things, but you have also been part of industries and your work with Alcon and other industry partners as well. How has that experience been for you and what made you shift from clinic to industry?
That's a great point. That's another really interesting path that we have an ability to actually participate in. So, in addition to being, clinicians, practice owners, or entrepreneurs outside of patient care, we also have an opportunity to work within industry. And really, if you think about it, anything that is in the exam lane that we actually use as far as tools and everything we prescribe in the exam lane, all of these things are actually produced by industry partners. And so, because we are end users of a lot of these tools and we are prescribers of these tools, there is a really important role for optometrists to play within industry. And that was something that I was definitely curious about. So when I got the opportunity to actually explore that, I definitely jumped at the opportunity because I saw that there was actually a really big uh, opportunity for us to impact the decisions that actually get made and that ultimately ends up affecting our patients.
And from being in clinic, being very successful as an industry leader, now you have taken another leap as an entrepreneur. And I know we briefly spoke about it when we met in person at Vision Expo, but I would let you kind of share that story of why you decided to leave everything behind to start something so amazing. So, can you tell me a little more about that?
Absolutely. So, it was kind of a means to an end. I ended up developing a device that helps patients insert their lenses We focused really on scleral and hybrid lenses because those were the lenses that were most difficult for patients to insert. Plus, they had an additional kind of dimension to them in the sense that they're medically necessary. So, if a patient is not successful in wearing those lenses, they may have to get a corneal transplant procedure, or they might be a patient who is suffering from severe dry eye that now can't get the relief of having those lenses and the comfort that comes with them. So, I saw it as a really high pain point for patients. And so I ended up really kind of working hard to pick up skills that I had really no prior knowledge of, talking about product design, 3D printing, manufacturing, all these things I really didn't have a background in, but I really just invested a lot of time online and reaching out to mentors and people who can really kind of help kind of steer me through some of these things. And once I actually developed something that I got great feedback from colleagues about, the next step became how do you scale this to
Hmm.
millions of people? Because that's really who ends up suffering right now is that there are millions of patients who need the help, but there is really no pathway for them to access it.
Absolutely. I'm just curious to know, did you learn all these skills yourself? Did you start like learning 3D printing, product designing? Did you try to kind of dive into it yourself, or did you take some course? This is very interesting for me.
Yeah, no, I just kind of dived into it myself. It's not as impressive as someone like learning how to play a musical instrument. I know those are the people that, when they say, "Oh yeah, I just learned how to play the guitar myself." Like I think that's super, super impressive. I couldn't do that myself, but learning how to do product design, CAD design, 3D printing, at least to me, it seemed like it was approachable because I was always interested in tinkering as a kid. I loved taking apart electronics and learning how things work. So for me, it was just kind of like a hobby of, hey, how do I get to actually design something in my mind and then actually make it come to life in the real world? The concept of that really fascinated me. So yeah, in retrospect, it definitely took a lot of hours, but it felt like, just fun. So it didn't really feel like a daunting task.
But that was all while you had a full-time job. So let's not spare that thing away.
Yeah, it's like some people have, hobbies of like hiking or, you know, doing, fun stuff. And, for me, it was kind of nerding out on 3D printing and CAD design. So each their own, I guess.
Yeah, that is fantastic. So I want to actually have I also have this question of the name of your company, which is Augmented Vision Labs, which is very interesting. And I want to know, did you have other alternatives? How did you come to this name? Like, what was the story behind this?
It's a great question. So, during that time, back in 2017 timeframe, I was very, very interested in augmented reality and virtual reality, especially, being an optometrist and seeing that you can interact with the visual system in a completely new way, especially when we're talking about vision therapy, sports vision training, neurooptometric rehabilitation. I could see that the tools to be able to interface with the visual system with technologies like augmented and virtual reality would be a complete game changer. Right now we use lenses and filters and prisms, and these are actually very great tools. But there is an additional dimension that when you can actually construct the entire visual environment for a patient and help them develop their visual skills through that, I saw like, hey, this is the future. And, I was like, if I can actually work at the space, I think I could really help make a difference with the traditional optometric education that I had because the engineers that were building those technologies, they typically didn't have an eye care background.
Absolutely. And I am a huge advocate about the fact that we need to be part of these decision making and the changes that are happening in this space, because the background that we come with, the skills that we have would be indispensable. So I'm so glad that you're leading the way for the industry and for the end users who'll be able to use it for maybe not eye care but for other purposes. But tell us
Yeah,
about the fact that you had also mentioned about taking a leap and being part of or collaborating with tech giants. And congratulations on the fact that Amazon has selected Augmented Vision Labs to join the Amazon Black Business Accelerator, which is huge. Can you tell us a little more about that story?
absolutely. So Amazon has actually been a great partner with us since 2020. And as far as what I was mentioning earlier about how do you develop something at scale, there's another challenge once you are able to manufacture something that's needed at scale. You have to actually be able to deliver it to thousands of people at scale. And so the support that Amazon gave us as far as being able to actually reach the patients who are actually in need of our products and also be able to, get those devices from us to the patient, that is, a giant kind of challenge in itself that Amazon really stepped in and kind of took the brunt of that effort because of the logistical network that they had built and also because of, how well known Amazon was, how many customers they had on their platform, and also the trust that they had built with everyone on their platform. And so being able to just list our devices on Amazon and have patients discover us through that platform was actually a really pivotal moment for us.
That's fantastic. So, a quick question. The device that you have developed to help patients with insertion and removal of contact lenses, is it available only Amazon, Amazon plus doctors? Like how can someone listening to this episode get your products or learn more about your products?
Absolutely. So we really have gone through with an all of the above approach as far as trying to create as much accessibility as possible. So our devices are available on Amazon as well as our website, augmentedvisionlabs.com, as well as through many partner organizations that we work with, which include teaching organizations, private practices, as well as some eye care distributors. So we really wanted to be, available to as many people as possible and to really make that process very easy to where we're not just making the product available, but also making the education around it available.
Mm-hmm.
Because as a student and even as an OD, I didn't really understand the full kind of depth of this issue and how many people really struggle with it.
Mm-hmm.
So we are really kind of focused on building as many relationships as possible to expand the education in the space, and then also make it easy for patients to be able to actually try the devices when they're in their doctor's office, and make it easy for them to purchase the devices as well.
That is amazing. And I will drop the link for anyone who's listening to this episode to check out their product. But I also want to know, I know you have built one product, but now you've learned a lot more throughout this process. Is there anything else that you have envisioned? There's any more solutions that you want to kind of bring into this space of eye care to help patients?
Absolutely. And so I will say that while the S5 insertion system was the first thing that I developed, there have been a bunch of other projects that I've kind of tinkered with along the way. I'm kind of one of those people who just can't sit still for whatever reason. So we've worked in the space of anterior segment photography and, additional things that never really made it past the drawing board. So, I'm always thinking and always exploring new ideas. I think it's just a matter of really understanding, is this something that would be a cool solution for me to have, or is this something that
Yeah.
there is a large need, out there in the world? So sometimes it's totally fine to build something that you enjoy just, for the sake of, solving a problem that you have. Uh, but kind of going forward, I'm really kind of trying to understand how do we help as many people as possible. And so, currently with the contact lens insertion space, we see that's a space that's really underinvested in, and there is a very great unserved need. And so that's why that is the main focus for us right now.
And I think you spoke as a true entrepreneur and true visionary that, the one sentence that I really loved was the fact that sometimes when you design something, it could be cool for you because you are invested in it. This is your design. But we need to kind of step back and look at the bigger picture of solving the real problem. And I'm sure everybody listening to this episode can who are probably building something can look at this as from a different perspective because you might be looking at it too closely and you might feel this is going to solve, but it might not really be a need. So I'm glad you brought that up, that it could be a cool project for yourself, but how to look beyond in solving societal issues and patient issues versus personal issues when you're building or innovating.
Absolutely. Yeah, it's something that is kind of easier said than done
Yeah.
sometimes, right? Because you have to be passionate about what you're doing. And sometimes you're passionate about something that, you see. And, it's not a one thing or another. Sometimes you see something that there is a bigger need than yourself, but other people feel that, hey, this is not really that big of an issue from my perspective. And
Mhm.
sometimes your perspective is different enough that you see something that others don't. And I think that's the point of being an entrepreneur is that you're able to solve solutions that are not there before you, right? The problems are existing, but for whatever reason, they're being overlooked. And if there are people who are being underserved because of that, then those are the people who are going to support you once you actually bring that solution to them.
Yeah, absolutely. And you know how we digged into the fact that you started as a clinician, then you were part of industry, you were an industry leader, you decided to kind of now focus full time on your business and your business idea to scale it. I'm sure throughout all these changes, you would have encountered multiple roadblocks, or I've recently learned from another guest that a challenge that was turned into an opportunity. Can you talk about some of the things that were probably challenges which or roadblocks according to you throughout this journey?
Yeah, of course. How much time do you have?
We can do another episode for this, I promise.
Yeah, we might need to do a part two. Um, but that is really the whole experience, I think, of being an entrepreneur is that if there are no challenges, then there's really no opportunity. So, a lot of times that the reason that you actually have an opportunity to do something impactful is because you're working in a space that others have found challenging, and those challenges have discouraged them from pursuing, the solution that you're developing. So, I would say that challenges are it is necessary, like a necessary part, not only of being successful, but of bringing something that's differentiated. So in the beginning, the big challenge was knowledge. How do you
Mm,
actually develop something that's a physical product? Because, I understood that training was not enough. There's great training, but there was something else that was missing. And so, now looking back on it, that theory has been validated because, through the work that we've done, we've shown that the right tool plus the right training is really what's needed to give a comprehensive solution to a patient. So in the beginning, I would say knowledge was one of the big bottlenecks.
that is one of the amazing answers I've ever heard. I know sometimes you might talk about exterior things, but talking about knowledge and then figuring things out, I think it's amazing. So
Yeah,
I know we did talk a lot about your journey, your challenges, but I would like to know a little more about who you are. So now we're going to dive into something fun, which is my game segment. It is a simple rapid fire round where all I want to do is learn a little more about yourself. So are you ready for it?
I'm ready.
All right. So tell us about your favorite destination.
Favorite destination might be Jamaica. Hard to beat. You have the beaches, the food, the culture. It's beautiful all around.
I haven't visited, but I'll definitely make sure that it's on my list. A hobby or something that you do outside eye care during your downtime.
I love to travel. I don't know if
Ah,
that's a piggyback off the previous question, but yeah, I love traveling and experiencing different cultures.
that is wonderful. One thing about you that people don't know.
Mm, Not sure what that would be. They already know that I'm a nerd. That's kind of out there now. I speak three languages. Maybe
Ah,
not everyone knows that.
that is wonderful. Your favorite cuisine.
Hmm. Might have to be Thai.
Okay, wonderful. If you were to interview a guest, dead or alive, who would that be, and what would be the question?
That is a very good question. Maybe Nikola Tesla.
Okay, and
Yeah,
what would you like to ask him?
I would ask him if he has any regrets about how his life played out.
Okay. All right. If we were to write an autobiography about your journey, what would you like the title to be?
Oh, that's a tough one.
It's a rapid fire. First thing that comes
It
to your
is it is
mind.
rapid. He tried.
He
Just two
tried.
words.
Okay, tell us something that you like and dislike about technology.
Well, there's a lot that I like. I like that it empowers people, and it helps you, expand your mind and think beyond your limitations. And one thing that I dislike is sometimes when it comes to technology, some technology is a solution in search of a problem and not so much designed with intentionality to solve a solution for someone. So, especially when you are on the development side of things, that's something that you have to be very weary of and make sure that, you're acting in the best interest of the end user of that
Mhm.
technology and not just making something that you'd like to see because you're using the knowledge and the skills that you have.
Absolutely. All right. So you did wonderful in your rapid fire. But we have another game, which is called Boomer Lingo. I'll be telling you few terms. It could be an abbreviation, it could be a language used by the recent generation, and I want to see your knowledge about that. So, are
Okay,
you ready about it?
I'm ready.
All right. We'll start with easy. IMO.
in my opinion.
Perfect. Flex.
I don't know if flex is a boomer term, but I think it's like to show off.
Yeah. I
Okay.
know. I mean things are changing so rapidly, so I'm just going to try and be in the
Hey,
yeah,
it's
so
okay.
somewhere that's
There could
easier
be
for
some
all
very
of us.
there could be some very hip baby boomers out there, so let me not typecast people.
Right. Cap.
Cap is faking or lying.
All right. Oh my God, you probably know it all. Now that I'm feeling nervous about it, but you're doing great.
Okay.
Basic.
Basic is plain, unremarkable.
Yeah, yeah. Drip.
Drip is fashion, being very stylish.
Yeah, and the last one, slay.
Slay is to kill it, crush it.
Oh my God, you did slay and crush this. You are my
Right?
only guest so far who has been able to answer all of these. So
Okay,
kudos to you.
I'll
And trust
take
me,
it.
even I had to Google some of them. So,
Okay, no worries.
so
I know Easy on Yama was on here before, so if I got to beat him at something, I'll take that.
I think this is fantastic. Kudos once again. So you
Thank
are
you.
a nerd, but you're hip and you're slaying. This
I'll
is
take
like
it.
a great combination.
I appreciate that. Yeah,
All
my niece
right.
will think I'm very cool. So
Oh, absolutely. Yes. I'm sure everybody will be like this was like, oh, maybe, I thought maybe you'll know one or two of them, but you knew it all. I'm like, oh my God. I need to
yeah,
up my game next time.
yeah, it helps having a 12-year-old in the family. You get to learn all the lingo. So
Absolutely. So before we wrap up this episode, I really want you to share one quick takeaway message for all my listeners. Anything that you want to share with us?
absolutely. So I really feel like the future for everyone right now in eye care is very bright because I feel like technology is going to open the doors to so many solutions for us as practitioners and also for our patients. So I do sometimes hear a narrative of, people kind of being weary or hesitant about what the future holds and how technology is going to impact us. But I will say that people have felt that way for generations. People were scared of electricity, the automobile, you name it out there. Any new technology that actually can kind of change the paradigm of how we do things has the potential of being scary, but also has the potential to really unleash new levels of success and positive impact. So I would say be very optimistic about the future because it's going to be great.
Absolutely. Thank you so much once again for all these insights, for all the learning. And I'm glad that, you have such a powerful takeaway message of not being scared of technology, but making it your partner and growing with it. So thank you once again for all your time and insights, and welcome again to the Nerdy family.
Thanks so much, Shakti. It was really great to be with you, and looking forward to connecting again.
Likewise.